Hello, I'm Anastasios Koulaouzidis and I'm an associate specialist at the Centre of Liver and Digestive Disorders at the Royal Infirmary of Edinburgh in Scotland. Together with my co-authors, Emanuele Rondonotti, Andrei Giannakou and John Plevis, we are pleased and proud to have our systematic review of the diagnostic yield of small bowel capsule endoscopy in iron deficiency anemia accepted for publication to gastrointestinal endoscopy. The idea for this systematic review came from our Edinburgh experience in using capsule endoscopy in this defined subset of patients with iron deficiency anemia alone. We all know that iron deficiency anemia is the most common cause of anemia and is responsible for significant disease-related morbidity. Furthermore, it represents one of the most common causes for referral to the secondary gastroenterology services. National and international guidelines recommend that patients with confirmed iron deficiency anemia should undergo evaluation with bidirectional endoscopy, whilst the investigation of the small bowel is generally safe for those with recurrent or refractory iron deficiency anemia. In our experience, the diagnostic yield of small bowel capsule endoscopy in iron deficiency anemia is about 30%, and the commonest finding, small bowel angioectasias. We have also noted that the detection rate of sinister pathology in those above the age of 40 is low, going down to almost zero in those above the age of 80. In contrast, we saw that 25% of those below the age of 40 had a sinister diagnosis on small bowel capsule endoscopy. We decided therefore to perform a systematic review of the diagnostic yield of small bowel capsule endoscopy in the subgroup of patients who have undergone the test due to unexplained iron deficiency anemia. The inclusion criteria for this review were publications written in English language and published as full papers, papers that provided sufficient data for us to confirm iron deficiency either in part or for the entire study cohort, papers that provided either diagnostic yield or enough data in order to allow us to calculate the diagnostic yield of small bowel capsule endoscopy in the iron deficiency anemia subgroup. For the purpose of this review, we define diagnostic yield as the proportion of patients with clinically significant angioectasias or other clinically significant findings. For instance, mucosal ulcers, intraluminal bleeding, mass or growth type of lesions. Our search generated two subsets of studies. Those specifically designed to evaluate the role of small bowel capsule endoscopy in patients with iron deficiency anemia, we call them subset 1, and those which investigated patients with a range of clinical indications, including a subgroup of patients with iron deficiency anemia. The pooled diagnostic yield of small bowel capsule endoscopy for detection of definite findings in the small bowel was 46%. Using meta-regression techniques, we found no evidence that study design influenced findings. In subset 1 studies, the diagnostic yield was about 66%, whereas pooled data from subset 2 studies showed that the diagnostic yield reached about 44%. Interestingly, these data compare favorably with those obtained in patients undergoing small bowel capsule endoscopy due to overt obscure GI bleeding. Overall, small bowel angioectasias account for almost 50% of the diagnostic yield of small bowel capsule endoscopy in patients with iron deficiency anemia. In an era of increasing use of anticoagulants and antiplatelets and expanding cardiology interventions, this information has potential clinical implications. To present, there is enough evidence to suggest that small bowel angioectasias are commoner with increasing age. On the other hand, only 6.6% of small bowel lesions are due to sinister findings in the elderly age group. In contrast, there is emerging evidence that sinister pathology, such as Crohn's disease or tumor masses, appear commoner in the younger age group. Hence, the presence of iron deficiency anemia in that group should never be ignored. However, this analysis cannot answer this issue, and larger, high-quality studies with appropriately selected iron deficiency anemia patients that take into account the long-term outcomes are still needed to firmly establish the exact role of small bowel capsule endoscopy in the diagnostic algorithm of patients with iron deficiency anemia.